Hey everybody. Looks like we're right on time, so I will go ahead and kick us off and welcome to Human Animal Families, Housing Insecurity, and the One Health Clinic supporting health and staying together. I'm very excited to be your moderator for this session. That will be an amazing session. The session today, our speaker is Natalie Rejto. And actually, apologies, I should introduce myself first. Again, I'm your moderator. My name is Erin Doyle. I am the Director of Veterinary Medicine and Community Initiatives at the MSPCA Angel here in Massachusetts. And as I said, our speaker is Natalie Rejto. Natalie is a nurse, researcher, and educator and is currently a postdoc at the University of Washington. She is passionate about supporting the health and well-being of humans and animals in their shared environment and the bond they share. And as a description of our session today, since 2018, the Seattle One Health Clinic has been providing free integrated human and animal health care in a pet-friendly shelter for youth and adults. In this session, you will hear about how this clinic runs and the impact on the health, well-being, and access to housing for youth and young adults in our community. We will describe 4 years of integrated human and animal healthcare services provided for young adults experiencing homelessness and their companion animals. We'll also discuss the human-animal bond and decreasing barriers to accessing housing with pets. Feel free to put any questions in the Q&A as we go. I'll help bring them to Natalie at the end, and otherwise we'll turn it over to Natalie.
Thank you so much for the introduction, and thank you all for being with us here today, connecting with my passion. Really excited to be in this community to share this work with you all that share similar connections. And my goal for the session today is to talk about the impact that we're seeing with the One Health Clinic and the model of care, specifically on rates of healthcare use among youth and young adults that are experiencing housing insecurity, and explore how treating the human animal family as a unit influences how that healthcare is delivered. And then finally, engaging with human animal family unit and how that supports earning trust as providers with community. And then finally, at the end, really excited to answer some questions that you all might have and continue the conversation. And before we get into looking at data and things like that, really important, I think, to focus on the storytelling piece as well, to share experience of what it looks like to see the One Health Clinic impacting housing and keeping families together. And I'll share an example with you. There was a young adult, Klein, and she was recently homeless, living in her car with her large dog named Virgo. Klein hadn't gotten health care for herself in over 2 years, not only just because it was expensive, but she had reasons not to trust doctors. Virgo needed veterinary care, and Virgo takes really good, Virgo is really well taken care of. And so Klein is really motivated to get the care needed. And she hears from one of her friends, her peers, that there's the One Health Clinic and they provide free veterinary care. So Klein comes into the One Health Clinic to take good care of Virgo and get veterinary care. And while the One Health Clinic staff, the navigators, are completing the intake paperwork to see what brings Klein in, Klein shared that she was recently unhoused and living in her car. The clinic staff told her that the shelter in which the One Health Clinic and the free vet care was provided could was vet friendly, was animal friendly, and she could probably stay the night there with her dog that she loves. So while Klein waited for her vet care, she connected with some shelter staff, and that day, Virgo got veterinary care, Klein got human health care, and they both slept together that night in the shelter. And to follow up, the shelter staff connected with Klein, and she, as well as her dog Virgo, were connected with housing 3 months later together. So, on theme with what we've been talking about for this conference, I'll talk briefly about the human animal bond, which is mutually beneficial to the humans and animals. And some of the things that we see in the poll, it can have human health benefits, such as increased self esteem, feelings of mental health and well being, can support feeling safe, can decrease feelings of stress, loneliness, substance use. And then we also see benefits for the animal, improved physical care, and then they also benefit from that companionship. And then, also, but some things that we also see is can result in some barriers, as some shelters and housing don't allow pets, or there can be additional costs associated with pet rent or pet deposits. And also, cost of veterinary care and supplies can be really challenging for folks. And as we all know, the animals are important family members, and those barriers putting folks in those situations to separate them from their animal family member has not been effective at housing. And so, to talk a little bit about our shelter that came up in the case in the beginning is there's the New Horizons shelter in downtown Seattle, Washington, and it's called New Horizons. It's specifically for young adults that are experiencing housing insecurities. And importantly, it allows for co-sheltering. So you can stay there overnight with your animal companion. The picture shows an example of one of the private rooms or called pods that they can stay in together. And there's service specialists to help support folks staying there and work to identify their shared goals, if it's getting housing together or whatever the client's goal is while staying there. And within that space, within that shelter, there's a clinic called Neighborhood Healthcare, and it's a federally qualified health clinic. So it's within that shelter and provides free healthcare to not only those staying there, but others that access that clinic that need it. Then, with those existing partners in 2018, the Seattle One Health Clinic was established with that real goal of honoring the human animal bond to address health and well being holistically, addressing the human and animal as a family, with the goal of building safety and trust, collaborating with clients and their animals to, like the shelter of New Horizons and the neighborhood healthcare clinic, to support empowerment and families meeting their goals. This clinic was very innovative in that it incorporated free veterinary care. And then the nurse practitioner and the veterinarian had the opportunity to work together to create a single healthcare plan to support the health and well-being of the family, to really explore the environment in which they share together and what their needs are. Do they both have access to clean water that they need? Are they both feeling like they need different resources in their environment? As we've talked about before, there can be A lot of overlap. So this really provided that opportunity to connect to clients through the human-animal bond. Maybe folks that hadn't come to clinic before, for all the reasons that we've talked about, that there can be barriers to accessing care, of having low trust in providers or bad previous experiences with human healthcare. During this veterinary visit, the veterinarian and fourth year veterinary students apply a trauma informed approach to delivering veterinary care, providing vaccines, resources for spay neutering, guidance on animal behavior as these young people are learning about themselves and their animals. Building the relationship during that visit, creating the space to learn about them, having inquisitive nature, asking about their environment, giving that opportunity to empower the human, identifying the great care that they're providing to their animal. And identifying when these human animal experiences overlap can create an opportunity to connect the human to the veterinary health, to the human healthcare services. Perhaps during that visit, during the veterinary visit, the human that comes in initially doesn't want human healthcare. They're prioritizing their animal family member that they love. Through the vet visit, maybe they are starting to build trust and share with the team that perhaps they would like to check in with the nurse practitioner to identify a shared health need. This provides a unique opportunity to integrate human healthcare. We think a lot about these barriers to accessing care, such as cost and these lack of trust, previous experiences with healthcare that maybe haven't gone well, fear of stigma from the healthcare providers, or the desire to prioritize your animal's health need above your own because they are your loved one and the most important thing to you. And perhaps some don't view their own health as a priority at that point. The One Health Clinic looks at these barriers and addresses them through providing this entry point, connecting with and honoring the whole family, including their animals. For youth and young adults visiting the One Health Clinic seeking veterinary care, the policy is they just say hi to the nurse practitioner. Maybe they're not ready yet to interact with healthcare, accept healthcare, but they'll check in. Maybe the nurse practitioner will tell them services that are offered in case if they think about it and might want to access care later. It opens the door to building trust, to meeting a human healthcare provider that has shared goals with them, connected to their animal healthcare provider. You can really start that building trust, that entry point of shared decision making, acknowledging what is important to them. Can have conversations that if you take good care of yourself, you are better able to care for your animal that you love. Can also change peer norms. Perhaps some who are living in the shelter have had experiences accessing human healthcare and they're able to, through word of mouth, share their experiences with others that are also co-sheltering with their animals. So really wanted to, as part of the research piece, explore by the numbers, what is this impact? that you might feel or see on a daily basis, or as we explored in the case in the beginning. But what do the numbers look like? Is they can be powerful advocating for changes in co-sheltering policies, for example, and directing resources to support people. And not too many people surprised that had been working within the clinic, we found that trust is being built, that these young adults are coming to get veterinary care and many accepting human health care and coming back. Through this 4 years of looking at data, there were 88 human clients that represented gender diverse, racial, and ethnically diverse populations, 171 animal clients, mostly dogs and cats. And this was for clinics that occurred between October 2019 and October 2022. There were 67 clinics that occurred during that time and a total of 245 healthcare visits. And perhaps extremely remarkable, over 80% of clients that visited the clinic resulted in receiving human health care. And this included 69% where the clients initially came in solely to get health care for their animal, prioritizing and taking really good care of their animal family. And of the 88 human clients who came in, 75 saw a human health care provider at least once, and 40% established healthcare for the first time over the past 2 years. So they had not seen a provider in the past 2 years until coming to the One Health Clinic. And really importantly, of those, over 85% had one or more follow-up healthcare encounter at the One Health Clinic or other primary services. All animal clients received their veterinary care that they needed. And talking a bit about how this connects to housing. The One Health Clinic with the model to have the veterinarian as well as the human healthcare provider work together creates this unique opportunity in terms of providing letters for emotional support animals, acknowledging that the process is complex, can be different in different cities and states, and many things to consider. In this setting, we see that the veterinarian can make sure the animal is healthy, support their health, and then being a good fit and providing any health needs for this animal. And the nurse practitioner can also make sure that the animal is a great fit to be an emotional support animal and then provide the documentation for that without having risk of adverse consequences for the human or the animal, and making sure that everyone's getting the adequate mental and physical health care that they need. And this really beautiful picture of the house on this slide shows months represented by the letter, and each key represents a person within the shelter that received housing that month. The heart over the key, really importantly, represents a human that received housing with their animal. And so, what's happening now? Some future directions and things happening throughout the country. That the model of the One Health Clinic has been adapted in other cities and states to support healthy families of people and animals. For example, in New York, a clinic used this model to provide free veterinary care and then connect folks to their own human health care as well. And with this experience, they are breaking ground to provide pro-shelter, low barrier housing. Within the community in Seattle, there is a new One Health clinic that is for folks of all ages at a low barrier housing within the city. And with these, model of care is adapted to meet the needs of the community. Really important part of it is learning what the individual communities value, what they need, and connecting with and partnering with the team members in that area. And current process is forming partnerships to adapt this model for a street med healthcare delivery for folks that may have different barriers, like not wanting to leave their area to go into a clinic to receive veterinary care and human health care. Some takeaways that we found from this study and this experience is that the One Health Clinic model of care can increase the rates of healthcare use among youth and young adults experiencing housing insecurity with animals. Treating the human family as a unit can support this providing of holistic healthcare. And also engaging with human animal family unit can open that door to building trust, acknowledging what is important to those that we encounter, who their family is, expanding our idea of what family is, delivering healthcare. And want to take some time to acknowledge this work that was presented for the presentation and the research is only made possible because of the humans and the animals that came to the One Health Clinic and trusted the clinic with their care. It's a result of collaboration of many people, including those at New Horizons, Neighborhood Healthcare, Washington State University providing veterinary care, University of Washington, volunteers from University District Street Medicine, as well as clinic staff. Really shows how collaboration and connecting together to provide resources, as well as engaging with and listening to communities, can make this stronger. And now really excited to hear questions or discussion points that folks might have. That you can pop them in the Q&A if you like.
Yeah, we have some good questions in there already. I can also direct if folks haven't been eyeing the chat, there's some lovely resources that have been shared in the chat and some offer to send along additional resources. So if you haven't looked at the chat before you log off, would recommend going there. But I can dive into the ones that are already in the Q&A and definitely, yeah, keep them coming as we go. Some of the questions in the Q&A came prior to the session, but I think it might still be great for emphasis. And so I know you talked a lot about building trust, but again, thought it might not hurt to reiterate because the first question was, how does combining human and animal healthcare in one place change trust and engagement for people experiencing homelessness compared to traditional services?
Yeah, and I think that's a great question to have Oak start us off, though. Talked about it a lot. I think it's something that we can think about, even if not in the setting where there's veterinary care and One Health, that engaging with clients and building that trust of if we know about building trust and trauma informed care, part of that is empowerment. So acknowledging the care, the great care that they're providing their animals, um, showing that we value what is important to others. So, who is your family? Who is important to you? So, I think there's a lot of opportunities to build trust, acknowledging and having a genuine like, love and respect for the bond of our clients.
Okay. I'll keep going, and I've noticed we've got some additional questions coming in. We have plenty of time, so definitely keep them coming. Another one also was submitted ahead of time, and you've touched on it a little bit, but it was, what is one thing that makes this model successful that other communities could realistically start doing right away?
Yeah, that's a great question that there can be, long-term connecting with Vicky Ramirez if interested in sort of implementing. But I think in the short term of something you can do today is have that approach. You can still have, even so, on the animal side, animal healthcare providers can think about that human animal unit in their shared environment. So, if, for example, if the animal healthcare provider is prescribing antibiotics to the animal, what is their lived environment together? Does the antibiotic need refrigeration? And do they have access to that? And yeah, being curious on the human healthcare side. If you're just providing human healthcare, having a non-judgmental, inquisitive attitude of what barriers they might face and really suspending judgment there because having that inquisitiveness and really exploring deeper if a client, for example, doesn't want to have a procedure that would have them in the hospital, really exploring why and connecting with resources if it's because they don't want to leave their animal or they don't have anyone to leave them with because that is their family.
Yeah, that's great. And as a veterinarian, I love the call out that you made initially about thinking about the holistic circumstances for the family unit when you're thinking about your treatment plan and making it something that works for everyone. So that was a great call out that resonated for me particularly. Uh,
Like what?
the next question is a great one. Is, have you used social workers and trauma informed care to help implementation?
Yeah, it's a great question. And something I think is really unique is the veterinarian at the One Health Clinic implements trauma informed care in the veterinary space. And with that, they have fourth year veterinary students and they teach to their students implementation of trauma informed care with veterinary care, which I think is so special. Um, and they've had students really connect with the experience and been sort of reminded why they got into veterinary care.
Mhm.
Um, and and with social work, this is the shelter in which this takes place. They have service specialists, and so they have a connection to try to get housing or other services depending on what their goals are as the clients, and which could change over time as they kind of get stabilized or connected.
Mhm. Yeah, absolutely. Great. Our next question came during the slide, so I was about halfway through, and the question is, can you describe the difference between the integrated care model versus simply offering co-located services?
That is such a great question.
Mhm.
I think the big difference there is the single healthcare plan, the communication and the collaboration for that holistic care. Yeah, if we think about examples in life, um, so if we consider the veterinary care is being provided, and maybe the animal has a fungal infection, that if it's just the veterinary care treating the animal um, side by side and they don't communicate, maybe this fungal infection is also contagious to humans. And so collaborating with that human healthcare provider to address that as well. Or perhaps medication that's being provided could be to the to the human, could have adverse impacts to the animal, creating a plan that works for both of them together and using each other as resources, I think is what makes it really unique, because there can be these opportunities that are missed that wouldn't come across because um, you don't know what you don't know as the human healthcare provider or the animal. So I think it's a really good example of stronger together and can identify gaps uh, in care of both. And oftentimes, things can overlap that maybe what's initially identified as the animal is stressed because of some occurrences in the environment, and connecting with the human healthcare provider because these stressors could be impacting the human as well.
Mhm. Um, I have a question. Okay, there's a couple other questions in there, but as follow-up for that, I'm curious about that relationship building across providers. And I know we've talked a lot about the client experience and the pet experience, but I'm curious if there's any tips to share about how you've cultivated those relationships across the human health and veterinary health providers.
With in this case in particular, I think the veterinarian is and the human healthcare provider have been doing this for a while now since it began, and are just wonderful and very, very collaborative with that and learning a lot. As a nurse, I feel like I see a lot of opportunity for that, as connecting to each other with everyone's strengths and identifying that there's another resource to connect folks with, that sometimes it's hard to think outside your wheelhouse when you're connecting with people. You think of, okay, I have referrals for this, this, and this. But I think that expanded thinking, and then the new clinic that's being started, or that has been going now for nearly a year for adults only. I think also you can really see over time the veterinarians and human healthcare providers, as well as volunteers, really learning and gaining those skills to collaborate. I think collaboration is such a great skill to have.
Yeah, absolutely. Um, and we've had a few more questions come in into the Q&A, which is great. They're wonderful ones. Well, actually, one that's at the top that I've been saving because it's much more of a logistical question, but I don't want the questioner to feel ignored, is if folks can get copies of the slides. And I don't know if you know, I don't, I'm sure the answer is probably yes, but I'm not sure if there's
Oh yeah,
strategies through the conference
for the
platform.
slides, yeah,
Yeah.
I would be happy to share the slides.
Okay, excellent. You can follow up on that. But another question that, again, these are all great questions, is were there any strategies you found worked really well at the clinics that helped to build trust with clients and encourage them to receive human health care? Or was it a more natural development that you just saw from from them attending with their animal?
It's an interesting thing on in it myself as my own experiences on an individual basis. Uh, I've seen volunteering as a navigator within the clinic, sometimes even through the course of the first healthcare encounter, uh, listening in an open, non-judgmental way. The over the course of the 30-minute, checking in and connecting with the veterinary care um, can break down sometimes those hesitancies. And I think that people in general can sense when you genuinely care, you're genuinely non-judgmental, your verbal and nonverbal responses. So I've seen that on individual basis. And then with this clinic in particular, there's been a lot of word of mouth
Mm,
within the community, looking back for the volumes of folks coming in. So I think that over time, the human healthcare provider can build a reputation based on that.
mhm,
And also, there's the just say hi to check in and know what services are provided as that sort of entry point, but not forced to receive that care. Because maybe they're not ready that day,
mhm,
but maybe they want to sleep on it.
mhm,
Or that's their first introduction and could go back for human health care on a day where there's not the One Health clinic, but the free health care being provided for humans.
absolutely. While we're talking about the teams, I think this one relates, so I'm going to jump to this question, is how are the medical teams, both the animal and the human side, compensated for their work at the clinics, or are they volunteers?
That's a good question. My understanding is the nurse practitioner is working as part of the federally qualified healthcare clinic. Um, and then the veterinary students that are fourth year, it's part of their rotation.
Hmm.
And the veterinarian is works here, but is out of Washington State University, is a faculty over there for the clinical rotation.
Hmm.
And then the navigators, that is one of the first points of contact that check in and navigate them through appointments and identify what their goals are and needs are volunteers from University of Washington, primarily health majors.
Hmm. And
It's a great
another
question. I
question.
think it really shows like effective use of resources.
Yeah, absolutely. And sustainability as folks like can give their time in a way that is also sustainable for them and making a living and whatnot. So I think that's is a great question and helpful to hear those details for sure. Um, super interesting question that would not have come to my mind. So I'm glad it was asked is could this sort of collaboration, or do you see a world in which this sort of collaboration also includes thinking really about the environment and things like soil and water testing, which would affect both the animal and the human?
I think that is a great question. And I think absolutely, especially, regionally, there's different things like valley fever in Arizona that can affect both human and animal.
Yeah,
But yeah,
absolutely.
not currently, but I think that could be a good collaboration. Maybe that would be county
Mhm.
level to
Yeah,
support that.
yeah.
But I love that idea because it really incorporates the environment.
Hmm. Yeah, I thought that was a really interesting one when I saw it come through and was
Mhm.
because yeah, wouldn't have come to mind, but so
Yeah,
important.
really relevant for sure.
Hmm. Those are our submitted questions, but we still have plenty of time, so I can give folks a chance. Or I think Natalie said it was okay with you if folks unmute and ask directly as well. Does that feel comfortable to have folks?
Yeah.
So yeah, feel free to. I'll keep
Yeah,
an eye on
or
the Q&A still, but
if there's an experience that someone would like to
mhm.
share as well, that would be great also.
Well, we've got another question in through the Q&A that I will ask, but offer still stands for folks to unmute. But the question in the Q&A is, how do you encourage follow-up care for clients to return reliably when needed?
That is a great question that I can't necessarily answer from because it would be from the nurse practitioner
Hmm.
standpoint. Just the and the numbers that we see good follow-up that is really unique, and those high follow-up rates are starkly different than other human-only clinics that they've studied within that are free clinics within shelter environment.
The question that came in is for ongoing care or emergency situations. Can you talk about your partnership with other organizations that support clinic clients?
Um, Other organizations, currently the team is beginning partnership with the local healthcare for the homeless network to connect with communities and those with lived experiences in terms of adapting for the street medicine model.
Mhm.
That's a really good question. And definitely want to highlight and underline the importance of connecting with community and those with lived experiences, with adapting, implementing, evaluating all the way through.
And Joanne, I see your comment in the chat, and apologies we weren't able to share directly, but and for context, Joanne had put in the Q&A the question about the environmental testing and
Mhm.
says that she has seen dogs and had dogs and cats die of kidney disease, perhaps sometimes due to the water, and also several that kept getting Giardia due to soil after rescuing elderly pets over the years. And it's difficult to get these types of things tested, and that collaboration would be important. And yeah, I know that's some of that stuff is always multifactorial, but of course, there's more that we don't know than what we do, I'm sure, in terms of environmental impact on disease for pets and animals.
Thank you so much for sharing that. It's something new for me to think about and consider,
And Deanna,
especially given the challenges that you've encountered with it.
yeah. And Deanna had shared in the chat, people need to know how much you care before they care how much you know, which is lovely.
Yeah,
Focus on building relationships. It's all about human connection, which I think is a really lovely sentiment.
yeah, I love that and connect with that so much. Thank you for sharing that.
Oh, Ken, I see you have your hand up. Again, I think the unmuting and the talking is not working. We can see if it works for you.
Can you hear me?
Oh, yeah. All right,
Yeah.
there you go.
Okay, great. I'm just wondering about like in rural parts and stuff when you're running into families and there's even farm animals and companion animals living together and have you come across any of that or and what that might look like?
That's a great question. And these specific clinics have been in urban settings. But I think there would be definite opportunity and value to adapting for rural community environment. And especially as you mentioned, if area with backyard farms or folks working in agriculture could add another important piece to that. It's a really good question.
It is a great question. It has come up in my work, mostly just on the
Yeah.
veterinary side, but in the balance of stationary clinics like that folks come to, which feels like in an urban environment, although there still can be barriers, as opposed to mobile clinics. If you have folks where it's hard for them to get to you. Yeah, I think that difference in the environments and how to accommodate folks in rural settings is such a pervasive one. So that's a good question.
Yeah, I wonder also about thinking about veterinary care and specialties, if there would be a need for collaboration for large farm animal vet, compared to small animal, cats, dogs to work together.
a really great point. I think oftentimes, just with the lens that I have had is focused on companion animals and particularly small, small animal companion animals, but there is certainly access to veterinary care. It definitely is a thing for large animals as well, very much so. And again, a lot of those same folks may have challenges accessing care for themselves too, just given the interconnectivity of the systems.
Yeah. And that environmental piece can be so different also.
Yeah, absolutely. Oh, Ken, I see your hand again. Yeah, absolutely. Would welcome follow up.
Sure. Well, I'm not really looking to follow up. I'm just
Oh, sorry.
some of the other things. Oh, sorry. Some of the other things I heard today was cross-reporting, and I'm wondering if you have any like insight or experience in maybe having an animal diagnosed with something, and then knowing that other people have come in contact with these people, like how that would look and stuff. Is there anything that has come up like that?
That's a great question. Not for me personally, but I find that very interesting with the cross reporting. Are you thinking of states and animal communicable diseases that also can go to humans as well, and that kind of collaboration at the sectors, thinking about the public health of humans, and that maybe if it's talking about like rural and animal, that kind of the collaboration there.
Yeah, there is some examples of avian flu getting into cat colonies and
Yeah.
TNR, and maybe vice versa, and just what is the impact of stuff like that, and is there any experience in it? Like, it could also be in the context of somebody going to one type of care, and you come to find out that they have an animal and that they need a shelter, and maybe it's a healthcare provider and an animal control officer communicating to where to go next and stuff like that.
Really great point. And I think that also lends to thinking about, as a human healthcare provider, having that holistic lens of asking the questions of, yeah, where do you live? Do you have animals? What is the environment? And then, yeah, thinking about for the avian influenza, if you're around wild birds, and just that knowledge of if your cat if is around them as well, maybe need to connect them to veterinary care. That's a really important point.
We have another question that came in through the Q&A, which is there anything that has surprised you about these clinics or any unique needs expressed that you didn't expect?
The thing I would say I'm most connected to in thinking about that question is beyond, as a researcher as well, beyond the numbers, which can be super important, that having the opportunity to volunteer as navigator with the clinic, that being able to see the impact on the individual level to me is incredible. That something even that a client, maybe it's your second time meeting them, and there's been something that has been concerning for them, and they haven't felt the trust or ability to bring it up before, and but has been causing, them a little bit of stress, to have that create that environment and that trust over time where that they're able to ask that question, or get referred to that care on that individual level, can be hard to measure, but I think is what really sticks with me and connects me every time.
Probably. That feels like such a lovely like mic drop way to end, but we do still have 5 minutes left, so I don't want to cut people off. Although I did love that. Felt like such a kind of really beautiful sentiment as we wind down. But that said, there is still 5 minutes left if folks have additional questions. That was reiterated in the chat. That was well said. So
Oh,
you're getting accolades in the chat. Yes. Oh, Ken, I see your hand again.
Yes. Another thing I'm wondering about is government funding. Has there been any applications to government funding or collaborating with government organizations to get this included in what they're doing type thing?
mm, good question. At the like thinking about the policy level and funding, not sure about that. Um, I don't know. Vicky's in the chat. There's an adapted mobile model of One Health Clinic in Southern Arizona that I believe is connected with the county. And they just had recently a paper published on their model that I think would be interesting to look at because I believe it's connected with the Pima County Health Department.
I know a lot of municipal animal shelters that engage in access to care for community members, and I'm sure there are probably some that have engaged in One Health clinic work as well, but I can't think of specific examples off the top of my head, but that is another approach that does involve government support. Let me another question as we in our last few minutes is how are these clinics considering protections from emerging threats like rising measles cases or ICE raids?
Yeah, that's a very good question. Um, I can't answer specifically of the ICE raids. And then with the say with rising measles threats as well. Can't answer specifically. I think that would be probably the public health guidance
Yeah.
of what is to be done. But yeah, really good question. An important one to make sure that communities are being protected from those two items.
Yeah, absolutely. And I saw that Amanda put a link in the chat to going back to the clinic you mentioned through Pima County to an
Awesome.
article about that. But yes,
Thank you so much.
there's a lot going on in the world that impacts all the work, so I'm sure your clinic as well. Um, well, as we that was really lovely. The Q&A was such a lovely opportunity to get more context. So thank you all for the questions, and thank you, Natalie, for really thoughtful answers. With a couple minutes left, I will start wrapping us up in terms of, but I know also, Natalie, you would offer it if folks send messages that you will work to answer everybody's messages. We thankfully got to the questions that were asked during the presentation, but if folks think of things, Natalie generously offered to help answer messages through the conference site as well.
And I want to say I really appreciate everyone's engagement with the question discussion portion. I think it makes the conversation so much richer.
Well, you're continuing to get some thanks and accolades in the chat, but yes, I will wrap us up for the day. And what a wonderful session! Thank you again, Natalie, and thank you to everybody that attended.
Thank you so much for your help.
Chasing